Alright, you're up, Steve.
Where do I have to go?
Yeah.
Let's go here.
Okay.
Alright, hi, my name's Steve Vicar. I'll be proctoring this exam for Miss Sarah June.
Okay. And you're a CRNA?
And I'm a licensed CRNA.
Cool. Alright. Thanks, Steve.
You're welcome.
Okay. So, hi, Abby. My name's Sarah. I'm the nurse performing your head-to-toe assessment. Do you have any concerns?
Not right now.
Okay. Are you on any medications right now?
I'm on birth control.
Okay. Any past medical history, significant medical history, surgeries?
I had my wisdom teeth removed.
Okay. And when was that?
Probably 2007.
Okay, perfect. So upon initial assessment, I'm just looking at the patient. Overall, do they look well-appearing, disheveled, cachexic, obese? She looks great to me. So I'm going to start with the head. I'm going to look at her hair, hair distribution. It looks even. I'm going to palpate her scalp. Then I'm feeling for any dents or bumps. No issues there. So I'm going to move on to, sorry, your hair. If you want to
This
fix
looks
it,
pretty good, too. I'm going to get that in there.
Okay. I'm going to move on to her eyes, and I'm looking at both eyes. Is she able to blink with no issues? I'm going to examine her sclera and make sure that they're white, no signs of jaundice. I'm going to pull down on her eyes just a little bit and look at her conjunctiva. We're looking for palpedema. I'm going to palpate. Any tenderness? Okay. Important to look for crustiness, any drainage, anything like that. I'm going to grab my light here. Okay, so I'm going to test for cranial nerves 3, 4, and 6. I'm going to have you follow my pen light, but not move your head, just with your eyes, okay? I'm dizzy. Okay, now I want you to focus on my pen light and follow it in, okay? Perfect, and I'm looking for convergence, the pupillary constriction as she focuses. I'm going to shine the light in your pupils. Making sure that her eyes are round and reactive and equal to the light. So.
With the start of the assessment, too, especially you have some equipment available, what else would you like to do? I mean, it's not usually part of the grading criteria here, but...
Yeah, we can do a set of vitals.
So let's do it.
Anything more than that. If they start feeling like people start telling them that they need to stop drinking, or if they feel guilty about their drinking,
right. Absolutely.
any of those things.
Very good.
If people
Excellent.
have confronted them to say, hey, maybe you have a drinking problem, those things like that.
And then also, too, when we're doing pediatrics, parents who smoke, secondhand smoke, is also a big issue also.
Absolutely.
So, very good.
Looks good.
Yeah, so that gives you a wealth of information right there as a baseline.
Okay, so we're going to move on to our scope here. Okay, I'm going to have you focus straight ahead.
And when you put the room lights down, because that's usually easier. Right.
So I'm able to see her physiologic cup and her optic nerve and vessels look good. I'm going to just do the left side here too now.
What's so important about examining the blood vessels in the eye?
Glaucoma.
Yep, and then what else?
Cataracts.
Cataracts, and then people with blood sugar problems.
Diabetics.
It's the only exam where you can actually physically see the blood vessels, so you can see a lot of physiologic problems underneath in the eyes. Yeah, a lot of times the first time they're diagnosed with problems. Yeah.
Actually, yeah, that's right. A lot of optometrists will tell patients, hey, you might want to go get an A1C done.
So when you were doing your exam, what were you looking for first before you enter the eye?
The red reflex.
Yes, very good. Excellent.
Yeah, so as soon as I see that, go in close. So we'll move on to her nose. I'm looking and making sure that it's midline. There's no obvious deformities or breaks. I'm actually going to have you tilt your head back so I can look into your...
Maybe on the prism.
So You want to look at the mucosa and the septum, make sure it's not deviated, there's no perforations, anything like that. I can test cranial nerve 1, but I'm just going to ask you if you've had any issues with smelling. If you can tell. Okay. Okay. I don't know if they have like alcohol.
That's what I was looking for.
You done those now or no?
Oh, yeah, there we go.
Super.
Alcohol.
Yep.
Strong.
Strong?
Yeah.
Okay. Alright. So then we'll move on to the mouth. I'm looking on the outside to see if there's any lesions or ulcers, which you do not have. I'm going to have you open your mouth now, actually. Okay, so I want to look at her oral hygiene, her teeth, make sure they're intact, she's not missing any teeth. I'm going to test cranial nerves 9, 10, and 12 by having you stick your tongue out and say ah. Looking at the uvula and her tonsils, make sure they're normal. Can you lift your tongue up for me? I can tell. I was actually going to say, wow, your frenulum is very long. Okay, perfect. And then we'll go ahead and test cranial nerve 7. If you can smile a little bit. Can you frown? Your cheeks out. Good. Okay, my hands are full. I'm sorry.
On the intraoral exam, what else are you going to assess for with the tongue and function of something?
The function of this one?
Yeah, the function of something that's in the mouth.
Salivary gland?
Salivary gland, so you can ask problems with that
Yeah.
also, yep. And then also detecting halitosis or other gum disease, correct?
Yep. And she has the news tobacco, so that's a big thing. So then we'll go to test cranial nerve 5. I'm going to have her TMJ here. Go ahead and open your jaw, move it side to side. Any issues, pain, any problems with chewing? Perfect. So we'll move on to the ears. That's cranial nerve 8 as well. I'm going to actually examine her ears, look normal. I'm going to do the whisper test. I'm going to occlude your ear. I want you to tell me the word that I say, okay? Baseball. He's flipping the pages every time we
Nope, that's okay.
Apple. Or you're deaf. No, I'm deaf.
Either one.
Okay, I can't hear you. And then we can test cranial nerve 8. So I'm going to hit this tuning fork, and I'm going to place it on your head. Okay. I want you to tell me if you hear it in one side more than the other, or in both sides equally. That's really loud.
Both sides equal.
Okay. Alright, now I'm going to hit it, and I'm going to put it behind your ear.
Okay.
And then I want you to tell me when you stop hearing it, and then I'm going to move it in front of your ear. Okay? Okay, that's hard this time. Okay, stop tape. Supersonic hearing. So that's normal. AC should be greater than bone conduction.
Yes, correct. Very good.
Alright, I'm grab my
And then laterality, right? Correct.
Oh.
There you go.
That's so cool. Bring you back to nursing.
And where are you putting the end of that tuning fork behind her ear? The mastoid process, correct. Then just one minor correction. Cranial nerve 7 for facial.
Yes.
Yes.
7,
good.
sorry.
What else could you do, like with the smelling test? We did the alcohol, but what's another way to assess if a patient's reporting problems with the nasal dyspnea or something like that, or problems with smells? Have them close their eyes.
Yeah, and guess the smell.
Correct. Yep, exactly.
Do something very
objects.
common.
Yep. And so what are you looking at right now?
Okay, I'm looking at her tympanic membrane.
Uh-huh.
And making sure that it's a nice pink, grayish color. I don't want...
Yeah, just go ahead and put the light on. So, just what we're going to do is, when you're taking a look, right, also what else are you assessing?
The bones.
Right.
The malleus.
Right. And then also, what are you looking at the TM also?
To make sure that there's no perforations, it doesn't look like it's bulging.
Yeah, no, I'm just trying to get it focused a little better. It was just out of focus, right? And then, yeah, definitely. So, her ears are pretty normal, right? Exactly.
And they're green, actually.
Yes.
That's good. You're like, I was nervous about that. So, looking for that. And we're going to move on to the neck.
Mm-hmm.
So I'm visualizing her neck, making sure that I don't see any tracheal deviation, which can indicate a possible mass, or any bulges. I'm going to palpate. Stand on your side here and feel for any tenderness or masses. Okay. So I'm actually going to have you turn a little bit to your right, if you can. And I'm going to try to palpate your thyroid here and find your cricoid cartilage. Go ahead and swallow for me. Good. Swallow again. Okay. You can feel the wings of her thyroid and make sure you're not feeling any nodules or it's not enlarged or super tender. It could indicate thyroid issues. So I'm going to have you turn back around towards me. Thank you. Okay. So I'm going to go on to check her cranial nerve 11. Go ahead and shrug your shoulders up against my hand. Good. I want you to turn your head towards my hand and meet resistance. Good. On the other side. Perfect. Okay, and I'm going to check her lymph nodes. We'll start from preauricular down to and then the submental, and then postauricular. Sounds good. You want to make sure you don't feel any enlarged lymph nodes. They're not fixed or tender. Okay. And I'm actually going to have you turn your head to try and get to the deep cervical ones.
Yeah, and also too, you want to, excellent, down the posterior border of the sternocleidomastoid mass. So when you come to the posterior auricular, you want to run your hand all the way down. Yeah, there you go. Because the lymph node chain comes all the way down. Good.
Good. Okay. So I'm going to have you, I'm just going to do cleaning up. So I'm going to palpate her carotids. Make sure that I feel a good pulse, but nothing bounding. I'm going to palpate them at the same time.
Yes.
Never. Cool. Okay. So I'm going to actually go ahead and auscultate her carotids now. Listening for, it's listening for bruits and making sure that I don't hear any whoosh abnormal sounds. So then I'm going to move on to her extremities. I'm looking at her skin, her color, any visible rashes or cuts or abrasions. I'm looking at her skin turgor. I'm going to go ahead and have you squeeze my fingers for me. Good. Pull me towards you and push me away. Good. And relax. Now I'm going to have you bend your arms. Push against. Don't let me push your arms down. Don't let me push your arms up. I'm going to do the same thing with your shoulders. Don't let me push your arms out. Down and then up. Good. Now relax. I'm going to feel her radial pulses. And the important thing is to make sure that they're equal bilaterally. One's not stronger or weaker than the other. They're not bounding. I'm going to look at her cap refills. Circulation.
And the normal time for that is?
Less than 3 seconds.
Yes.
And while I'm here, I'm also going to examine her nails for any clubbing or deficiencies or if it's coming off the nail bed, something like that. When I move down to her legs, so same thing, I'm looking at the skin color of her legs. Can she feel sensation? Can she feel that? Any numbness or tingling? Is It's especially important in diabetic patients to assess that. I'm also going to look for edema in her. Actually, let me take her shoes off. Sorry.
They may be silly. I told you I sweat.
Trust me, in comparison to diabetic patients,
we went to field training together, so we've seen it all. We've seen it all.
So I don't see any edema. I'm going to check popliteal pulses here. My hands are really cold. I'm sorry. I promise I don't just stick them in ice water on purpose. Dorsalis pedis and then the posterior tibialis pulses as well. And it's good to look for skin color, hair distribution. In women shave, but like for men, that can be indicative of vascular disease if there's abnormalities between the two sides.
Very good.
I'm going to look at her calf refills, and I think your feet are cold, so they're a little bit slower down on the bottom. And then in diabetics, it's really important to check the feet and make sure they don't have any sores or issues down there. All right, I'm going to actually take this and check her reflexes. I'm going to relax your arm for you.
Good. No, that's good.
Preeclampsia.
Yeah, I forgot. Alright, and this is a weird one where I need you to be really dead weight all the way, hang your arm really loose. Alright. Guys, don't relax your arm.
That's it. It's
moving your. I can feel your tendon.
What reflex is that right there?
This is the radial.
Yep.
And then this is the
brachial radialis. Yep. Right there. Yep.
Okay. Loosey goosey. Dead weight hanger on. Okay. All right, and then your knees.
That's good.
Don't kick me now.
You'll start running. Home with an sad.
Alright, and then feel your Achilles reflexing. Just relax your foot here. Alright. Check reflexes there. Alright, I think we're going to move on to the pulmonary cardiovascular system.
I'm pretty much done with the head because there's a couple other things. About the eye test and stuff like that. You're going to come back to that? The corneal light reflex. What are the 6 cardinal positions of gaze? We did that already, right? Okay. Let's see what else here.
I had the convergence test.
Okay. And you did everything. Yep. You get everything else in the eyes. Okay. Just want to make sure we get everything. What about reading and visual fields test?
I can ask when her last.
You're going to do that last, or?
Optomic, yeah.
Okay, all right, no worries.
When was your last eye exam?
Mm-hmm.
Probably a year ago. You don't wear glasses, or
I don't wear glasses.
So you had a
No
vision
trouble.
test.
No trouble reading or driving.
Just other people driving.
One other assessment in the eye, also.
The lacrimals?
Yeah.
I palpated hers.
Okay, all right.
Making sure there's no crustiness or tenderness.
All right.
Okay. If you don't mind taking your shirt off. Go on to the pulmonary assessment. Okay. So initially I'm going to visualize. I'm looking at her anatomy to make sure she's not barrel-chested or doesn't have pigeon chest or anything that's going to cause this deformity to affect her breathing. I want to just take a look at her work of breathing. Is she having retractions? Is she in a tripod position? Does she look like she's struggling to breathe? Can I hear any audible stridor or wheezing, even just standing next to her? And I don't. She looks like she's calm, breathing normally. So next I'm going to do tactile phragmatist, and I'm going to palpate. And every time you feel the blade of my hand, I want you to say 99.
Okay. 99. 99. 99. 99. 99. 99.
The most important thing with that is to feel the vibrations equally on both sides. So if one is less vibratory than the other, then you worry about possible fluids or infection going on. Same thing, I'm going to percuss her back and do the same technique. And I want to avoid the scapula because that's obviously
Very good.
I think the bra might affect the skin. I want to check for any dullness might be indicative of fluids in the lungs. I'm going to have check for the thoracic expansion, so I'm going to place my hands on her back, and then I want you to take a deep breath in and let it out. And so with that, I want to observe my hand and make sure that I'm seeing both hands rise symmetrically. One thumb is not pulling further than the other, and it was even, so she's got bilateral normal lung expansion, chest expansion. So I'm going to actually test for her diaphragmatic excursion. So Abby, what I want you to do is take a deep breath and then let it out and then hold it. Okay? Okay. All the way out and then hold it. So I would mark a line right here. Okay, you can breathe. All right, take a couple breaths. And then I want you to take a deep breath in and hold it. So the
Sounds good. Yep, looks about right.
And 3 to 5 centimeters is the normal. Sorry, you can breathe if you're not holding your breath. So that's about the normal width that your diaphragm should be moving with inspiratory and expiratory.
So with pulmonary, 2 things we're assessing, right? The extrathoracic or whatever, the rib cage, right? The supporting muscles, right? And then also like the spine, everything, right? And then the other things are the intrinsic lung disease, right?
Mm-hmm.
So all the other stuff.
Right, so I'm
fluid,
going to
right?
Yep. Moving on to auscultation here. Every time you feel my stethoscope be placed on your belly, take a deep breath for me, okay? Okay. And so I'm listening for any adventitious breath sounds like crackles, stridor, wheezes, any diminished lung sounds. You want to compare both sides and all the lobes, and her sound clear bilaterally.
What would concern you, signs of acute versus chronic lung sounds, lung changes?
I would say, like in someone with COPD who's a chronic smoker, you're going to expect to hear some wheezing and adventitious sounds. If someone who is as healthy as Abby is, and she's a runner with great, pulmonary abilities, I would be nervous if I, heard a bunch of crackles out of nowhere in her lungs or.
Right. Well, and the problem is that, air trapping with the chronic obstructive diseases will have reduced respiratory excursion.
Right.
But wheezing is always a bad sign.
Right.
That's an acute, that's a reversible component that probably should warrant referral and treatment for
right.
that. Wheezing is
it's always, or something?
Absolutely.
Especially
an adult or a child, and adult too.
Okay.
And especially with smoking or whatever, exactly.
Yeah. And while I'm back here, I'm actually going to just palpate your kidneys. Let me know if you feel any tenderness. Okay. And that's a good sign. You worry about pyelonephritis or UTI if someone has really tender flanks. If sometimes you touch them and they say it hurts just even with a light touch.
Right, because the kidneys lie retroperitoneal, right? They rise more towards the back.
Yeah,
very
so you
good.
can't really assess them towards the front. So I'm just going to, I would do the same palpation and tactile pharmacist anteriorly, but because for privacy, we're going to skip that part. I will auscultate your lungs anteriorly and start above the clavicle.
Well, she's thin enough too, so doing your assessment in the back, because you can tell by visual inspection she doesn't have any difficulties. Good.
Okay. So So I'm just going to move on to the cardiovascular. Once again, you're just visualizing initially to see if she's got any deformities. I'm going to go on and palpate first. For any chest pain or tenderness. And then I'm also feeling for heaves or lifts. So abnormal flow of blood, a rush of flow of blood. In some patients, you can actually feel the mitral pulse. If I have you lay down on the left side, I'm going to use So any tenderness issues, do you feel like you get palpitations or butterflies in your chest, anything like that? Okay. Take a listen. So I'm listening for the normal lub-dub, S2, which I hear, and then you want to listen for any other murmurs, S3, S4, a gallop, any bruise, abnormal sounds.
Where do you or listen for the aortic and pulmonary valves?
So the aortic is on the second intercostal space on the right sternal border, and then the pulmonic's just on the left side. And then Erb's point is the second and third and fourth rib below that, and then the mitral valve is the fifth intercostal space, mid-clavicular line. And
also you can almost palpate the PMI or the apical pulse. Describe about the S2. Can you tell me about the physiologic split of S2?
Not in depth.
Just what it is, because it's a normal one sound. It's not abnormal. Yeah.
Right. So it's S1 is diastole, right? And then S2 is or is it
the other way?
Okay.
But you might hear it. People might describe it as a murmur. It's a normal physiologic split with the changes of inspiration and expiration.
Okay.
Because what happens when you take a breath in, it's a negative inspiratory pressure against atmospheric pressure, and then when you let it out, you're going against, you're putting a positive pressure. That changes your blood flow, especially your venous return, so that's why you get an augmentation in the filling pressures. So that's why it's a normal.
That's why. Is that why they say sometimes you should hold your breath? Have the patient hold their breath?
And with murmurs and stuff like that, exactly. Like some people like myself, I have a normal physiologic systolic murmur, so that's why I'll have to lean forward, take a breath in, and then see if it's accentuated. Yeah, or if there's an extra beat in between there.
Okay.
Yeah.
Cool.
If the valves aren't closing properly.
That makes sense. All right, so I'm going to move on to the abdominal assessment. So I'm going to have you lay flat. All right, I'm going to get a cold for you.
Oh, it's okay.
No bad nerves.
My shirt. My footy shirt.
Okay. So I'm visualizing the abdomen to see if there's any notable masses, deformities. Some patients have protuberant abdomen, they're obese, and you can almost see the wave, you can see any fluid waves if they have peristalsis. With the abdomen, it's important to auscultate before you palpate or percuss. I'm going to go ahead and do that. You must not be hungry.
I'm breaking.
Your stomach is wide. So I'm listening for the normal clicks and gurgles of bowel sounds. It's important to listen over the organs to see if you can hear any rubs, which can indicate inflammation or enlargement. And then I'm going to palpate with my really cold hand to torture you. So I'm going to just palpate for any masses, which I don't see any. And then any tenderness, no. Any issues, normal bowels.
For the most part.
Yeah, for the most part, yeah.
When I run,
yes.
yeah.
runners issues. Okay. So she doesn't have any, and then I'm going to percuss. But you would want to hear that same resonant sound that you would hear in the lungs because the bowel should be filled with air. If you hear a dull sound, you want to consider obstruction, mass, things like that.
And what you did too, that's in asking about their bowel habits. That's very important.
Yes.
It is.
Gotta get personal in the medical world.
Mm-hmm.
There's no shame. All right, I'm going to try to palpate your liver. Some people, you can't palpate the border, so it might be a little uncomfortable. Go ahead and take a deep breath for me. Actually, I can feel it. Yeah.
And I'm just going to show you a little bit of a critique on your. You did the basic light touch, but when you're doing the deeper organs, it's easier to do both hands. Okay. See that? Press down and find the organ. I'm sorry if it's a little uncomfortable. And come from the plant, come from the side, and then see rub. Now I can palpate the border, and then see that it's a little bit easier.
Do you like that technique versus the hooking technique?
Yeah, no, you can hook at the same time, so you can, because you can feel the edge of the liver and stuff like that, and then you can move. See it with your other hand.
Yeah.
Same thing with the kidneys. It's just a lot easier.
Deep breath. Okay. And then you want to just feel for.
And sometimes too, doing cross, opposite side, and then pushing towards you. I see that done a lot. It's a lot easier than trying to
do the hook method.
See doing it here and here. It's easier to come across from the opposite side. See, especially because the kidneys are so. Now I can see how I can feel the organs right there. See, it's a lot easier.
You got your kidneys in
your
hands right now.
It's just a lot easier to come across the opposite side.
So
and then if you want to come from the flank too. Yeah, see, it's a little bit easier, isn't it? Yeah.
You want to feel for.
Especially somebody thin like her, it's to take advantage of it.
Yeah. So you would do the same thing on this side, but ideally on the left side, you're not supposed to feel the spleen.
Right.
Because that could indicate enlarged spleen, which is not good.
Exactly.
Maybe you want to take a deep breath for me. So yeah, all I feel on this side is just her rib cage and your.
And tell me about the liver. Where should the liver normally be?
Right below the 12th rib.
Mm-hmm.
And then you can percuss to try and.
So you're just basically barely feeling the inferior lobe of the liver, right? That's normal exam. If somebody has an enlarged liver, what else would their stomach might be like?
They're going to have the ascites. It's going to be very protuberant and rounded and tender.
And then with portal hypertension, they're going to have
the
JVD and then the
so
spider
we can assess
telangiectasias and all that.
So I'm going to actually have you turn your head to the left. Let's see if I can see. Actually.
Yeah, and her carotid pulse, what should that normally be?
It should normally be.
You can see it right there.
You don't want it too high. You don't want it too
low.
It
should normally be.
Right in the middle.
Yeah, about 2, or for me, my thumb, in fact, but 2 finger breaths.
Right, 2 fingers.
Yeah.
I can see it.
Exactly. Same thing with JVD and all that stuff.
She doesn't have this.
Right.
Yeah,
Exactly.
which is good. You don't have JVD.
Yep.
Good. And that's the same thing. But I know with so you want to visualize for any pulsations.
Mm-hmm.
And then, like for myself, on really skinny people with her, sometimes you can almost see their aortic pulsations. But we're good. You don't have an aortic aneurysm.
No.
Yeah.
You're good to go.
Good.
Okay, so, I did the spleen, I did the liver, and then got the kidneys, and then I did the percussing on the back.
Mm-hmm.
So that's that. If you want to put on your shirt so you feel your privacy. And then we're going to move on to a couple last cranial exams, neuro exams. So what I want you to do is take your hand, and I want to hit the back of your hand to your legs, and then flip them over and hit your palm to your thighs. And do that as fast as you can. Yeah, she has no issues doing that. Alright, and then I want you to close your eyes. I'm going to stick something in your hand. It's a very common object. And then I want you to close your hand around the object and tell me what it is. Okay.
A bobby pin.
Yay, good job. Now I'm going to keep your eyes closed. I'm going to write a letter on your hand, and I want you to tell me what letter that is.
Is it a P or an S? I don't know.
Hold on, I'm doing it sideways. Okay, so this is the
bottom.
You're going to do it that way. Okay, like this.
Hey!
There you go.
Yes.
It's sideways.
Give her just the eye or something.
Simple, her name's
Yeah.
Abby.
Yes.
So I thought maybe she would get that. Okay, I'm going to have you stand up now.
Okay.
We're going to do the Romberg's test. I want you to put your arms out.
Okay.
And close your eyes. I want you to stand shoulder width apart, sorry. And so I'm observing for if she's swaying, if her arms drop. Stroke patients usually can't do this. You got a stroke. So that's normal. You can put your arms down.
Okay.
Okay, and then I want you to actually walk to the sink and walk back normal gait. And turn around. And she has no problems doing that. So now what I want you to do is a heel-to-toe walk in a straight line to the sink and back.
Okay.
Oh, heel all the way, right foot.
Oh,
right
on top of it?
Yeah.
Okay.
Like you get pulled over on a
Yeah, I
traffic
was about
stop.
to say.
Sobriety test.
What else might you want to key in on gait, especially older patients with osteoarthritis, degenerative joint disease, stuff like that?
Their range of motion.
Well, yeah. Now also with their symmetry, their alignment, they'll have either varus or valgus
Right.
deformities, whatever, one knee bowing out, and then you'll see them like this, and then they have, complain of a lot of knee pain, again, or hip pain. That's
Right.
when you want to target. Does your hips hurt, stuff like that, one hip worse than the other, and they'll tell you I have bad arthritis. So that's, like I said, again,
It's important to start at
key
the
for a
beginning.
referral, because you're going to be their
Right.
primary care. Well, we may need you to send off for an x-ray and what the orthopedic consult, stuff like that. But generally, problems in gait, that's the first thing that show up. And also looking
They limp.
at their shoes.
Yeah,
If
if
their
they
shoes
have.
are worn on a certain, like I
Good
said,
call. Yeah.
stuff like that.
They're limping on that side. But do you have any joint issues, any joint pain? Okay, so the last thing I'm going to have you do is if you will stand facing away from me, in front of me.
Mhm.
Go ahead and bend forward and try and touch your toes. It's okay if you can. And then stand back up slowly. Good. And then go ahead and bend back as far as you can. I don't expect you to be able to touch the ground. Okay, and then you can go back to normal. And then I want you to go bend to your left side as far as you can. Bend to your right side as far as you can. Good, and I'm just visualizing her spine, making sure I don't see any obvious deviations or scoliosis, and her spine looks good.
Yep.
Straight.
And where could she have scoliosis? What part of her spine?
It would be the thoracic area.
And lumbar, all the way starting. It depends how severe.
Yeah, and I know that some women, even if they're young and healthy during pregnancy, will get their spine will start to misalign.
Mm-hmm.
So.
Yeah, another thing too is keying in on with sports injuries too. 'Cause you're a big runner, right? Avid runner, so any problems with their knees or anything like that, ACL or whatnot. Good.
Alright. I think I've completed my head to toe.
Do we do our hips too?
Oh,
Yep.
Stand.
yep, I want you to lay down.
Yeah,
Okay.
we need to do
So what I'm going to have you
strength
do
of all our extremities.
is
Yep. Wrists,
go ahead and
hands,
push
hips.
your leg against my hand.
Pretty good?
Yeah. And then opposite. Oh, good. This side too. Good. And then
Awesome. And Vern's side.
yeah, I know, right? Alright, and then I'm going to have you make frog legs and then try to keep me from pushing your knees together. And then the opposite. Any pain in your joints with that? And then I already did her upper extremities earlier.
Yep, we did all that. Yep, with the hands, wrists, fingers, you did all that. Yep, exactly. What's another thing with the leg raises?
That can be
Did we do those yet?
the leg raises.
Extended leg raises. That's part of the exam also. You scoot up in the bed a little bit.
Oh, sit.
Lay
Yeah,
down.
scoot
No,
up
lay down.
more. Yeah, it's that way your legs. Yeah, the same thing.
Yeah,
Leg-
to test
Leg raises. Yep.
strength.
right? Same thing. That's also part of the test for back injuries and stuff like that.
And you can also do it for appendicitis.
Yeah. And also, did you assess the hips too?
I thought that was the.
Well, no. They also same thing. Hip joints too. You actually want to palpate. See that? Same thing with the knees. See it?
No issues.
It's
there.
a little bit, same thing. Range of motion.
Gotcha.
All right. And also, you want to palpate the joints too. That's another. See that's normal. But also, like I said, with the hip strengths, they're going to have problems with the hip adductors or the IT bands, especially in sports, athletes. But leg raise is also with low back pain.
Okay. No issues. She's a beast. Ready for her next marathon.
In January.
Anything else? You want?
No, that was it.
Okay. Good job. Turn this off.
Did we finish everything? I think we
I
did.
hope so.
Let's see.
I can leave it going.
No. I think you can shut it. I would shut it off.
I didn't
right
go
now.
by all the systems on the thing. Sorry.